Okay, good afternoon. Thank you so much for joining us. My name is Vivian Uccello. I'm the Public Information Officer for Riley County, and I'm here with Julie Gibbs, Local Health Officer for Riley County, as well as the Health Department Director, and Robert Koppel, we call him Bob, who is the President and CEO of Ascension Via Christi Hospital here in Manhattan. First of all, thank you guys so much for your time today. I know you're incredibly busy, and I appreciate you taking some time out of your day to talk with us. We are live on the Riley County Health Department's Facebook page. At the end of this video, I'm going to also upload the footage to the Riley County YouTube site. So just to make sure it's as accessible as possible to as many people as possible. I'll be keeping track of the Facebook comments, and we'll try to answer as many questions as we can during the broadcast. I'm anticipating there will be more questions than we'll be able to get to. So afterwards, I'll go back and try to answer your question in the comments if we're not able to get to you. So again, thank you so much for being with us. Today is Thursday, January 13th, 2022. We'll start off with you, Julie, if you could give us an idea of what the situation has been like for the health department.
Sure, thanks, Vivian. Hi, everyone. Riley County is currently monitoring 1,017 active cases. We've had a total of 1,202 new cases since last week, and our percent positive has increased to 20.58%. We did unfortunately have to report on 2 more deaths this week, giving Riley County a total of 68 COVID-related deaths. We are still offering free drive-up testing through collaboration with KDHE on the weekdays from 8 to 5 at the mall parking lot. No appointment is necessary, and this is a free PCR test. We are also offering symptomatic rapid testing here at the health department Monday through Friday. So if you have symptoms, please call the screening line at 785-323-6400, and we'll get you scheduled for a rapid test here at the health department. We are still providing COVID and flu vaccinations at the health department by appointment on Tuesdays and Thursdays. Please call 785-565-6560 to get scheduled. It is not too late to get vaccinated if you haven't been. Getting vaccinated has been our best defense to severe illness and complications with COVID. Please consider doing it. If you have any questions about the vaccine, talk to your primary care provider. With the amount of cases coming in, our team here at the health department and our school staff cannot keep up with contact tracing. We do our best to investigate positive cases, and if they are part of a congregate setting, we will let that place know. But beyond that, we are asking for your help. If you test positive, please contact anyone you are around within 48 hours of testing positive, or if you're symptomatic, within 48 hours of developing symptoms. These would be individuals you had close contact with, meaning you were close together for longer than 15 minutes. There is guidance they can follow on our website at rileycountyks.gov. The main reason for this message today is not only because our active cases are the most we've ever seen, but because our hospitals around the state are hurting. With COVID and other illnesses like flu, it's the perfect storm for our already understaffed and overworked healthcare workers. Please continue the safety precautions we've been preaching for the last 2 years. Please stay home when you're sick, and please consider getting vaccinated. Thank you.
Thank you so much for that information, Julie. Bob, did you have an update you'd like to provide, or shall we jump right into questions? Oh, and Bob, you are still on mute. I'm so sorry.
Sometimes it's better if I stay on mute, Vivian. But, so we started the day at the hospital. We had 14 positive of interest, perhaps, to people. 8 of those were on our medical unit. 5 of those are in the ICU. All 5 of the intensive care patients are on ventilators. And we also had a positive patient in OB. So that's a very high risk situation for that family. A couple of things I guess I would just want people to kind of have some perspective about, perhaps. We have now had 5 COVID-related deaths in the last 7 days at the hospital. That's something we've never actually experienced here, not that many. And they're from a variety of different counties. And so that's why there's always that kind of that disconnect. I think people are wondering why the health department reports one number and we report another. And it's because we certainly, the person who died yesterday was from Wabunsee County. So we're certainly serving people in our region. We have had a third of all of our COVID deaths in the last 90 days. And so I think that's also, I mean, give people a perspective. And I know there's a lot of people like, we're going to be done with this. We're finally over. And actually, from a severity perspective, we've actually lost more people in the last 90 days than we did the previous, that third of the people in the last 90 days, everybody else in the previous 18 months. So again, I think it's just some things we would really want people to be conscious about, of taking those mitigation steps like we talked about, but also just to have that perspective. In talking with some of the outpatient primary care providers in Manhattan, actually today, I've had an opportunity to talk to people from a couple of different practices. A couple of things they've said. One, they've actually never seen this volume of patients in their careers. Just shockingly high number of people who are ill and need to be seen. And partly that's because COVID is not happening within a vacuum. We still have all of the normal things that happen in January. So we have flu, we have strep, we have lots of people just getting colds, ironically, other coronaviruses, just at the same time. One of the physicians specifically said, nobody should assume that this is just my normal allergies or that this is just my normal cold. This is the year when you probably should make your way down to the mall parking lot or go to your primary care office, or go to make an appointment with the health department and get tested, because that's going to be helpful to that physician in kind of laying out a course of treatment for you. The other thing we've noticed in our facilities here in Manhattan and in Wamego, and I think somewhat in the clinics in town, are people not being honest when they're coming into our facilities to be screened at the entrances. And we would just encourage people, you need to be honest about your symptoms, you need to be honest about what's going on. And that may mean that you're going to come in through a different door. You're still going to get treated. Don't worry about that. But just, we really are trying to segregate, if you will, keep apart those who are known positives or known symptomatic. And we're also going to try to get those people in and out as quickly as we can, regardless of the service they're here for. So just really encourage people to be thinking about that and really to take this very seriously.
Thank you so much, Bob. As we are dealing with this surge in the community, and I think we can call it a surge, and hospitals and your staff, local doctors are, like you said, seeing the most patients they've ever seen in their careers. At some point, access to testing is going to be really difficult to find. We've already seen lately the lines at that KDHE site in the north parking lot of the mall. Those are very long lines. It's taking longer for those tests to be processed. The health department has appointments available Monday through Friday when you call that screening line, but it's getting increasingly more difficult to get through to the screening line. So as we face this idea that the virus will continue to spread, it may become more and more difficult to find access to testing. What's advice that you've heard from local physicians as you're speaking to them about what people should do if they think that they have COVID?
Well, I think it's an honest thought. If you look week to week, from last Wednesday to this Wednesday, I think across the state of Kansas, we had 52,000 new cases. So again, that's about 8 or 9% of our total for the entire 22-month experience. So I think the first thing is, if you have symptoms, say it's 8 or 9 in the evening, well, this is a good time just to, as long as it's not like life-threatening symptoms, you just need to self-isolate, stay wherever you live, your apartment, your home, and just stay there and try to stay away from other people. And then, again, it's nice, actually, you can go on the websites for the county and see what's available. We know the timeframes that the KDHE swab station is open. That's, it's 8 to 5. That's pretty consistent. First thing next morning, or if your physician office has a web option, you can always try to notify them that you need an appointment, or try to make that appointment if they allow self-scheduling. But the other thing is, call your provider office and get scheduled for an appointment to be seen. The confusing part of all of this is you have 2 or 3 things going on right now that all have the same symptoms. And it's probably going to take some lab work or some conversation with that provider to sort out, you don't have COVID, but maybe you have the flu. And so they're going to take you down a different path then for treatment because of that. But definitely, just the self-isolation, wearing a mask. I know that we've talked about that a lot in the last 22 months. That still remains the best option. What we've learned with Omicron is that it probably needs to be some level of procedure mask. The cloth masks are just not as successful as they have been with both the Alpha and the Delta and some of the other more minor variants. So these are pretty key, and certainly encourage people. I'll get on my little bit of a rant, but when you're going out, this is the time to be wearing them, seriously, because we do have so much just viral stuff going on in the community. You layer on COVID, and it can make it a risk to go to the grocery store, to go to shopping or do whatever. And you can mitigate the risk by wearing a mask and doing hand hygiene. I mean, it really is that simple. You really can mitigate a lot of the risk, and so would certainly recommend that people do that. If you're going into a public space, so for example, I went to the K-State men's basketball game last night. One, it was not an issue to social distance, nothing against the team or the crowd, but it was not an issue to social distance in Bramlage. But we wore a mask the whole time. It's not like after 22 months, I don't think that's harsh or hard for any of us. But it's doing things like that. You're still able to participate, still be involved, and you're just taking some steps to protect yourself.
Thanks so much for that information. Julie, what are you seeing in terms of testing at the health department right now?
Currently, we have plenty of tests available. That's not to say we won't be saying the same thing, 5 or 6 months from now. So what I can encourage people to do is, call our screening line to get tested. If you have symptoms, even if it's mild symptoms, we encourage you to come in and get tested. If you're having trouble getting through that screening line, we do have large call volumes right now. So please have patience with us. Just hang up, wait a few minutes, and then try to call again. If you're still having some trouble, there's always the mall parking lot available. They do a PCR test, so it's going to take a little bit longer to get those results back, but that's always an option for you. We try to get people in as quickly as we can once you call our screening line. But again, you do have to be symptomatic. We cannot see you if you just drive up. You do have to have an appointment. We can't see drive ups just because that's not fair to those who have made appointments. So we're okay on testing right now, but that's not to say that we won't be in the same boat, months from now. So another thing that I'm going to encourage people to do, something that we're seeing is individuals who are testing every day with the rapid tests. And although I understand why you'd want to do that, maybe you tested negative and that could be a false negative, so you want to try it again the next day. I would encourage you rather to confirm with a PCR. If you are symptomatic and you do get a negative test, you can request a PCR. And again, you can always go to the mall parking lot if you'd like that instead. But that way you're getting that confirmation, and we're not wasting our test supplies, so to say, with our rapid test, because that's really where we're going to see it, where we're going to hurt down the road is with the rapid testing supplies. We've just heard from the state this morning that they have no more supplies, so our orders aren't being fulfilled. So we have enough to get us by right now, but please just be aware of that our supplies won't last forever.
Thank you. I'm going to take a couple questions from Facebook right now. Robin asks when and whether or not we can confirm that the surge in Raleigh County right now is the Omicron variant. You could talk about that a little bit.
Yeah, we can almost definitely confirm that. While KDHE labs are only doing random sequencing to determine if it's Omicron, we have seen Omicron in our county. And we can almost say with absolute certainty that most of our new cases are the Omicron virus due to the fact that it's spreading so quickly.
And then again, Robbie asks if masks like the KN95 or surgical masks are available from the health department, or where people can go if they want that type of protection.
I'm sorry, say that again, Vivian.
I'm so sorry. Robbie on Facebook asks about the availability of procedural masks, such as surgical masks or the KN95s. Can people go to the health department to obtain masks, or where should they go if they'd like to have that layer of protection?
So not to the health department. We do have supply, but we do reserve those for our medical facilities and the health department staff as well. So for right now, Bob, I don't know if you have any more information on exactly where they can find those easily.
You can go to any of the pharmacies grocery stores, department stores like a Walmart, Menards, even places like that sell the procedure masks now. That's not hard to get to. They're not hard to find at this point. Can I go back a couple of things to you mentioned, Vivian, or Julie mentioned? We are starting to see shortages of all kinds of things. The testing, I think, is just kind of on the horizon, as Julie indicated. That's so far so good, but I think we all know that that's going to change in the coming weeks. But there's certain medications now, again, that are in so short supply. We actually have a significant blood shortage in our state. As of earlier this week, the Red Cross notified all the hospitals that they no longer have blood in stock. And so if a hospital needs blood, they're going to have to get it from another hospital. So we're just, and this is kind of COVID related, it's people have stopped going to blood drives. And so we really need those kinds of activities to keep happening, because that's what allows a lot of other healthcare to be provided. So would certainly want to put a plug in for that. The other thing too, I should probably just mention, we really are asking people not to come to the emergency department if you want a COVID test. That is not an emergent need, and it will not be prioritized at all as an emergent need, because it's not. We're going to take care of emergent patients first. The other significant difference for people is that the testing, like it with the health department and with KDHE at the mall, it's free. If you come to the emergency department, there's an emergency room visit charge for that. Plus, you will also be charged for the testing. So we just really want people to understand that. You know, it's very different too if you are very symptomatic, you're having chest pain, you're having difficulty breathing, those sorts of things. Well, we don't want you going to the mall parking lot. We want you to come to the emergency department. So just really try to think about the appropriate place to get the care that you're in need of.
Thanks for bringing that up. That's a really important point. And I was planning to ask one of you to help identify the emergency symptoms of COVID. So what are those things if someone is at home and they think they have COVID, what are the emergency warning signs that should send them to the emergency room or direct them to call 911?
Well, I'll take a little bit of a stab at that, with also the caveat that Bob is not a healthcare professional in that respect. I'm an engineer by training, not a healthcare provider. What we see a lot of people coming in with is very acute shortness of breath. They're just people are really having a difficulty just simply breathing. And with COVID, you also, it's kind of sporadic, but there's kind of these weird neurological experiences people are having, certainly cardiac symptoms that people are having. There really is this range, and that's why it's a little difficult to say exactly. I mean, there's not like this, if you see these three things, you should go to the ED. It's really not that easy. And that's why if you start to be symptomatic, that's why you need to be reaching out to your primary care provider and kind of getting in that process. And also that's an opportunity for them to be talking to you and knowing that, you know what, we may need to call Bob back tomorrow because we weren't able to get him in, but we talked to him on the phone. So we really need to try to get him in the clinic tomorrow, or we're going to call him back tomorrow and just do a check-in, that sort of thing. It really shows up so differently. And for some people, it's a slow kind of process. Other people, it is a fairly immediate onset, very significant symptoms within a matter of an hour or so. And so that's why it's kind of difficult to say this is the box that looks like, because it really does show up differently. We know who we tend to be seeing in the hospital are those who are not vaccinated. That's by far the largest population. Certainly are seeing people who maybe had a vaccine or maybe even had 2 doses. And there's a handful of folks who've even had 3, they've had a booster dose. Those group of folks tend to be folks who are pretty immunocompromised or have some really other significant health issues going on. We've had a number of people come in for other issues entirely. And then they're talking with staff, and we go ahead and swab them just because of some comments or experiences they're having, and they end up being COVID positive, in addition to, quite honestly, their primary need to be in the hospital, kind of incidental to that. So it really does show up differently. Largest population though, 80+%, 90% some days of who we're taking care of are unvaccinated. The comorbidities or the other things wrong with people that have been true for the last 22 months, obesity is, you're challenged if you're obese, unvaccinated, and you get COVID. Doesn't really matter what variant strain. That's just and along with that is folks who are diabetic, have CHF, COPD, cardiac issues, all these other things. And so that is just a concern. We've seen a lot of middle-aged people in the last month or so, because Julie and I are texting or emailing, probably not every day, but pretty darn close. And it's 30, 40s, 50-year-old, probably the 40 and 50-year-olds who have been the biggest bunch of people that we've been seeing hospitalized for the last several weeks. Certainly have a few older people tend to have other health issues, but it's middle-aged people, working age people that we seem to just see a bunch of folks for.
Thank you. I hate to ask you to predict the future, and that's not really what I'm trying to do, but this weekend, we're going to have a large influx of residents as K-State students return to classes. Knowing viral spread is at the point it is now, what are you anticipating for the coming weeks in Riley County?
So I was on an email earlier with Dr. Gorel. He's the medical director at Lafayette Health Center for the university. And he does a lot of research on this. And based on the data from other countries and states, the peaks are occurring about 24 to 26 days after they start. So he anticipates a peak in cases any day now for the US as a whole. However, the wave in Kansas actually started about 10 to 12 days later. So likely late next week for us here is when we'll peak. With the students coming back and with indoor events taking place, our numbers may stay elevated for a while. However, we are hopeful that within the next week or two, we'll see that peak and we'll start to get some relief.
And we have a member of the media with us here today. Christian, I'm sorry I didn't get to you sooner, but Christian Bright from the Mercury, would you like to ask any questions of Bob or Julie?
Yes, I would like to ask Bob what staffing is like in the hospital right now, and then what hospital beds, what it looks like right now, if they're filled, how many are open, or.
Sure. So staffing is, I mean, that's been a challenge from day one. I would say it's exacerbated across the entire state now for two reasons. One, we actually have fewer healthcare workers in our state than we did 24 months ago. And that's a variety of reasons for that, but a lot of people are choosing to maybe do something else or somewhere else. To try to move patients within the state right now is extremely, extremely difficult. And that's, again, two factors. One, a little bit smaller workforce, but we are having a whole lot of staff out. Healthcare workers are now out because of this wave of COVID, because everybody lives in the community and we don't really have community mitigation steps in place anywhere. And so you're actually seeing, because I mean, people got kids in school, they're going to activities, they're doing their shopping or whatever. And we certainly encourage our staff when they're not here to wear a mask and do those things, but you can't really force that. And they have families, right? So on any given day anymore, we probably have 10 to 12 of our staff here in Manhattan out. Kind of fluctuates, quite honestly, because people are they're out, then they're back, then we have other people out across the state. We have, I don't know, it's well over 1,000, if not 2,000 healthcare workers out any given day now because of their own exposure or being positive. And, you know, again, our experience here is, so we're swabbing some staff who are symptomatic every day because they come in because we're doing that all internally to take care of our workforce. And we're finding people who are definitely symptomatic, but it's not COVID. They've actually got the flu, or they've got RSV, or they've got one of these other viral things that's going on. And so you kind of have that at play as well. And that's what's contributing to all the staff being out. I mean, there's been actually a lot of news stories, I'd say over the last 2 weeks, about pretty much all the larger health systems in the state have, you know, talked about hundreds of staff being out. And, you know, Ascension View Christi is no different, or not immune from that either. We're just smaller here, so our numbers are smaller. But you take any of our teams and you start to peel people out, and then that definitely impacts how many patients you take care of. That just, and the offices are having the same issue too. So on the outpatient side, you got the same thing going on there, regardless of specialty, by the way. Every physician you talk to in our community either has staff out or had staff out last week, or know that they're going to probably have people out next week. I know there's been some school closures around the state, certainly in our region, our community as well. Personally, I think it's probably a smart thing to do on a short-term basis, just to keep everybody apart from one another. The question about the students coming back, I don't really know. They're coming from all over the state, and we have Omicron everywhere in the state. And so it's not like that's going to bring something into the community that we don't already have. So yeah, it's hard to say. I agree with Julie completely. We are not at our peak yet. I think that's pretty apparent from the data. It's going to keep climbing. And then we'll just have to see kind of what the other side of the peak looks like. In South Africa, the peak happened, they've gone down, but they've actually hit a plateau. And now they're at that level, and they're continuing with new infections every day too. So we just have to kind of see what that plays out for our part of Kansas.
We only have a few minutes left, and I want to try to get to a couple more questions online. Dana asks if the definition of a close contact or the procedure for a close contact changes if a high quality or procedural mask was worn at the time.
No, the only time that it would change is within the schools. We do have special definitions that we are given from KDHE, and that is if both parties are wearing a mask and no closer than 3 feet, they would not be considered that close contact. And that's the only variation that we have from the definition of a close contact.
Well, and I'm going to follow up on that a little bit, because from the guidance that I've read online, the wearing an N95 or a procedural mask, I thought it did mitigate that close contact, so that you didn't necessarily, if you were in contact with somebody for fewer than 10 minutes, you were 6 feet apart or more, or masks were worn, that did impact things. And I might be wrong about that. Just want to make sure that I'm understanding what you say.
We'll have to clarify that, because things have changed so much with the guidance. We had the big guidance change right after the holidays with CDC, and then they actually did another guidance change after that. KDHE just recently changed their close contact to fit CDC's definition. And so we've had a lot of communication going back and forth between the schools. So we'll have to clarify on that, Vivian.
One more quick question, and then we'll wrap up. You've mentioned that contact tracing with the volume of cases is no longer feasible for the health department, for schools, or really for KDHE at the state level. A few people have offered to volunteer as contact tracers. From what I understand, that's really not possible with patient information, but if you would speak to that for just a moment.
Right, and that's very kind of them to volunteer. We've had great success with volunteering with our volunteers throughout this whole pandemic, so we really appreciate that offer. But no, at this time, we would actually have to go through a hiring process and hire individuals back on and go through some HIPAA training and all the other training that you need to do for contact tracing. There's quite a bit to it. And quite honestly, just with the volume of cases that we have coming in, even if we had our full contact tracing team here that we had in the beginning, we still wouldn't be able to keep up with it. We were on a call yesterday with KDHE, and they are still going to be doing case investigations like we are doing with the primary positive case, but they are no longer going to be able to do contact tracing starting February 1st.
Okay, thank you for that. Just kind of to wrap things up, do you have any general health advice? Get good sleep, get exercise. I know you've talked about that from the beginning, that taking those steps that we all know are good for our health are good to do right now. If you would speak to that a little bit, and then we will probably have to end the broadcast for today.
Absolutely, yeah. All of those prevention methods are great to keep in mind. Don't forget your exercise, your sleep, getting good nutrition. All of that's so very important, especially during this time when we're in the middle of flu season. Our COVID cases are high, so definitely don't forget that. And certainly if you're sick and you can't find testing, please just at least stay home, or again, like Bob said, call your primary care provider. But we definitely want you to stay home and get some rest when you're sick. That's the most important thing. And above all that, please consider getting vaccinated. I mentioned it earlier, but if you have questions or hesitation about the vaccine, please reach out to your primary care provider or get information from a reliable, trusted source.
What are some avenues people can explore for getting vaccinated or boosted if they want to do so?
There's quite a few places in town that are offering the vaccine. So pharmacies, the health department, that's a great resource. Again, that number to call to get scheduled is 785-565-6560. We are offering the flu vaccine as well, and we can do them both at the same time. So if you call and get scheduled, we'll get you in on the Tuesday or Thursday. We've had a pretty good steady stream of individuals that are calling to get the vaccine. So we're hopeful that more and more people will get vaccinated.
Thank you so much. Thank you all for your time. Christian, did you have any final questions?
I do not. Thank you.
Okay, thank you all so much. Take care. And for anyone who had questions that we weren't able to answer during the broadcast, again, I'll go through and try to answer those by text. I hope you all have a good day. Thank you so much for joining us.